Hola y bienvenidos a mi canal Learning Spanish with Señora Ramirez. Are you a nurse or a doctor that treats Spanish-speaking patients and would benefit from learning some helpful phrases that would help you communicate better with your patients? Do you often find that meaning gets lost in translation when dealing with your Spanish-speaking patients? If so, follow me, Señora Ramirez, in this video all the way to the end, and I will teach you 10 helpful phrases that will help you communicate better with your Spanish-speaking patients. Without further ado, let's get started. The first and probably the most important question that you should ask your patient is, do they speak English? So, in order to say, do you speak English, you would say, Usted habla inglés? Once you've determined that your patient does not speak English, then ask them what their name is. ¿Cómo se llama usted? And this is the formal way of asking the patient's name. The next phrase on my list of helpful Spanish phrases is ¿Dónde le duele? ¿Dónde le duele means where does it hurt? You could also say ¿Qué tiene usted? Which means what's wrong, or ¿Qué le pasa? Which roughly means what's going on. The next phrase on my list of helpful phrases is ¿Cuáles son sus síntomas? Which means what are your symptoms? Your patient may reply with one of the following, although this is not an all-inclusive list. This is just a starting point for your Spanish. And so they may reply with Me duele la cabeza, which means my head hurts, or Tengo náuseas, I'm nauseated, or Me duele la garganta, my throat hurts. Or maybe they say, Tengo fiebre, I have fever. Or No puedo respirar, I can't breathe. These phrases will give you an idea of where to start with your patient. The next phrase on my list is Usted está embarazada. Now, I know this phrase looks like it says, are you embarrassed? But that is not what embarazada means. If you ask your patient, ¿Usted está embarazada?, you are asking her if she is pregnant. That will be good information to know. The next phrase that is on my list is alta presión sanguínea, which is high blood pressure. Maybe you need to tell your patient that he or she has high blood pressure, and you could say, Usted tiene alta presión sanguínea. The next phrase on my list is dado de alta, which means to be released, as in to be released from the hospital. An example of that could be used in a sentence to give you some context. Su esposo será dado de alta cuando esté despierto, which means your husband will be released when he wakes up. And the last phrase on my list is the word for heart, which is el corazón. Maybe you're in the office with your patient and you ask him, ¿Qué tiene usted? Remember that from before? What's wrong? And he says, Me duele el corazón, or Me duele el pecho cerca de mi corazón. My heart is hurting, or the chest is hurting close to my heart. So here you'll know that his issue is something to do with his heart. Guys, before I end this video today, I want to give you a list of the 10 phrases, as you'll see here, that we covered in the video that will help you communicate better with your patients. The first one is Usted habla inglés. Second one is ¿Cómo se llama usted? And then you can ask them ¿Dónde le duele? O ¿Qué tiene usted? O ¿Qué le pasa? ¿Cuáles son sus síntomas? ¿Usted está embarazada? Dado de alta, which means released, or alta presión sanguínea, which is high blood pressure. And the last one is the word for heart, corazón. Okay guys, that's going to be it for today. I hope you found value in this video, and if you did, that you will consider subscribing to my channel, drop me a like, and ring that bell so that you'll be notified of future videos that I will upload to help you make your Spanish better. Hasta luego!